Thank you very much for joining me. Yeah, we're very excited to talk about your recent publication in Community Dentistry and Oral Epidemiology.
Mhm.
Um, so we would just like to start with getting a bit of an understanding, like an introduction to you, like what uni you're affiliated with, and how did you get to this place in your research? Um,
So I am Srinath Madathil. I'm an associate professor at the Faculty of Dental Medicine and Oral Health Sciences at McGill University, Montreal, Canada. I was originally trained as a dentist. I used to say long ago I was a dentist, but then I switched careers essentially into cancer epidemiology and statistics. That's my graduate training in, and more recently, so mostly my work is in epidemiology and more recently in AI because I was in statistics basically. So AI applications in oral cancer, along with some oral epidemiology with methods. This is my area of interest. Yeah, so I was always been interested in methods. My PhD work was also developing some methods. So I'm looking for novel approaches which could help us have better research in oral health. So that's how we came about to this particular project.
yes, that yeah, certainly are novel approaches. So, what was the motivation for getting into this project specifically and applying these methods that you have?
Right. So being my my background is in oral cancer epidemiology, and in oral cancer, several risk factors are already known. Major risk factors like smoking, betel kid chewing, socioeconomic status, education, alcohol, HPV status, several of things. So, but there are several studies also looking into novel risk factors. One of which is very interesting for dentists and important for screening purposes of oral cancer and understanding high risk population is oral inflammations or oral health. And there's a couple of studies we look into whether poor oral health is associated with increased risk of or developing oral cancer or not. On broadly head and neck cancer, which includes both oral oropharyngeal and laryngeal cancers. And the evidence is mixed in the sense that some studies have found some strong evidences supporting the risks and increased risk associated with poor oral health, and some of them finding no associations. And these are mostly because oral cancer is takes a long time to develop. Most of the studies are observational studies, which means that they are not experimental in trying to change oral health and see how it affects oral cancer. But they look at people who have oral cancers and who do not have oral cancers and see what kind of risk factors they have. These kind of studies have several methodological issues, and the ways in which the analysis is done can also induce some bias into these results. So we were interested in knowing, oh, there is mixed results in the literature. Could this be because of some biases? For example, one common bias is an unmeasured confounder, an unmeasured common thing, which could cause both the poor oral health and oral cancer. But oral cancer directly doesn't cause poor oral health doesn't cause oral cancer directly. This is one of the problems.
Mm.
So one way to test this is to do this kind of analysis, which is known as negative control exposure analysis. And that's how we came to this project. And so we used a fairly large case control study in oral cancer and looked into oral health, poor oral health as the exposure, and first looked at okay whether there is association or not, and then we bring sexually transmitted diseases like syphilis, gonorrhea, lifetime occurrence of those, which is known to be not causing any oral cancer. So then supposed to be not causing any oral cancer, right? So in your study, if somebody finds an association between these things which supposed to not cause cancer, being associated with cancer, that leads to then starts red flag saying that, oh, this could be probably there are confounding issues happening, there are some selection bias happening, which could have kind of affected both this main interest, which is oral health, and the STDs. So if you don't find anything in for negative control exposures, which gives us at least that kind of confidence that potentially there is not much unmeasured confounder issues in this particular study. So that's what we did in this particular project. Yeah.
Okay, that is so interesting. And so, in like layman's terms, what would you say like the key findings that you um, report on?
The key finding is that we when we tested this, we did not find any evidence for having an unmeasured confounder in the study. And the originally the oral poor oral health, specifically not having um, at least nine functional tooth or having a partial or complete denture can increase the risk of having head and neck cancers by 33 to 34 percentage higher risk compared to people who do not have those things. Provided that these this evidence should be taken with some grain of salt that this could be still, it's not really causal yet. But the take home message is that oral health is very important to be monitored. And a self, especially when there are less and less population-wide screening of oral cancers compared to other kind of cancers, it's up to each of us to actually think about oral health and be aware about, oh, this could be potentially higher risk of oral cancers. Um, yeah, and for dentists too, in terms of thinking about poor oral health, importance of maintaining that good oral health, and how it affects, life-threatening disease such as oral cancer.
Absolutely. So, what is the impact of this paper on, like, how does this matter for equity, and what should we be doing with policymakers based on
Right.
this
So a
finding?
major equity issue in specifically for all cancer is the issues of access to care, specifically in terms of access to a specialist to get diagnosed with oral cancer, right? And this is being shown and it's been well known that this barriers of access to care, one of them is this socioeconomic issues, right?
Mm.
And at the same time, and we also see that poor oral health has the same kind of patterning, right? So it brings up an important additional point that for equity matters is is that poor oral health need to be people with poor oral health need to be considered as high risk people also for oral cancer. That adds an additional lens to having health equity in terms of oral health can lead to health equity probably in oral cancer. Um, yeah.
Absolutely. All right. Is there anything that we haven't covered yet that you'd like to make sure gets out there? Always.
No, I think one of the motivation for us to do this paper was to bring attention to the research community that we should not stop once we get a positive signal of whatever hypothesis we are testing and closing the paper and saying that, oh, we found something. But it's important to go dig deeper and do analysis, which is testing our own kind of notions, being more self-critical by doing these kind of controlled analysis or quantitative bias analysis to see and have a more conservative look at the results, especially nowadays because of um, misinformation and as it gives that's what something which we wanted to bring attention of the researchers to this kind of field. Yeah, in oral
Yeah,
epidemiology. Yeah.
absolutely. Well, yes, thank you so much for contributing to such an incredible paper and then sitting down with us and making sure that we can all get a bit across it more. Thank you very much for your
My
time.
pleasure. Thank you. Thank you for the opportunity.